Hey everyone, it's Dr. Jonathan here at Kalkstein Chiropractic, your Baltimore area chiropractor. And today we're going to do a little examination. We have Becca here. She was recently just hired. She's amazing. She's going to be on the exercise floor. So if you come in, you're going to be working with Becca on the floor, and we're going to have a good time. But Becca, you're coming in with a little bit of mid-back, low back, and some upper neck tension with some bilateral knee pain.
Yes.
Occasionally?
Yes.
Okay. So, Becca, usually new patients will have like paperwork to fill out. That's all done, completed. So now we're going to work through examination, what we do for new patients, what we find during the examination, and then adjustments and then treatment plan going forward. So we're going to take you on that journey now. So firstly, I would always start looking at posture. So if you want to come towards me, stand as you normally would. Don't try to impress me with the posture. And today, ears are pretty level, left shoulder slightly lower. I'm going to place my hands on your hips. And that's my hips. Hips are also level. So, presentation-wise, the posture could just change from day to day, so it's not really all and be all. If you don't have really great posture, that's okay. It's not going to be clinically significant, or it might be, but most of the time it's usually not. But let's face this wall now, please. Side view, we have ears in line with the shoulder girdle, and everything looks really good actually. So you work out regularly, you move really well. Good. So that's pretty adamant to her lifestyle, so she moves well. From time to time she just gets a little tight in some areas like normal people do. So side view looks really good. So next, face me. We're going to look at range of motion. So you're going to look as far as you can to your left shoulder, as far as you can. Oh my goodness. That's really good. So I would say that's full. Go towards your right shoulder. That's pretty good. Equal bilateral. She compensates a little bit with her muscles here. Which way is easier for you to get to? Yeah, I would agree with that too. So rotation's pretty good. Let's look all the way down to your floor. Don't worry about having really good posture. Almost around your back. There you go. So good spacing, almost full. If I apply a little pressure, does that increase any symptoms, or is that a stretch behind your neck?
Kind of feels like a stretch, like it's tight.
Okay. And then look all the way up. So really good. Range of motion, almost full. If I have you up, rotate, and then press, how does that feel?
I can feel it on that left side.
On the left side, okay. And then right. And how is that one compared to the other side?
Not as much as on the left side.
Okay, but you still feel more on the right, or when I do that right side?
I still feel it, but not as much as I do feel it when I do it.
Okay, so that's just a little compression test that we do. So she's positive left compression or right compression with those facets. So now I would test muscle strength if she was coming in with neurological symptoms, but for the video purposes we'll demonstrate them too. So if you want to have a seat for me, please. And then arms out like this. I'm going to push, don't let me, try to resist me. Very good. Same thing, I'm going to gradually push, don't let me. And she's super strong. Good. Arms here. So a lot of these positions that I'm testing are called myotomes, and a myotome is just a nice name where a nerve root, so don't let me pull, is correlated with specific muscle groups, and just testing each segment. And as expected, she's super strong so far in all ones. So elbows in, wrists up, hold, hold, beautiful, and then flip them, same thing. And if there is any weakness in any of these, then that might tell me there might be something more central to the spine coming from the neck, or maybe something more peripheral out into the limbs there, which we'll definitely test out as well. So far really good. Fingers out for me like this. Don't let me bring your thumb and index together. Beautiful. Same thing. Don't let me press. Very good. And then claws, flip them, don't let me pull. Beautiful. So I would mark she's perfectly fine strength-wise, so no neurological deficits there. In addition to testing strength, I might test out sensory. So you're gonna have your hands kind of on your thighs up. You're gonna close your eyes, and I'm going to kind of rub some areas of your arms, and you're gonna let me know if it's the same or different. Good. And generally, I would have her in a gown, or usually skin on skin, but for videos and patient-wise, I'm just gonna do through her hoodie.
Let's see.
Good.
Let's see.
Beautiful. And then last one, arms out a little bit. Just right there and underneath her tricep. So sensation-wise, all normal as expected. That was more so upper extremity. So upper extremity, range of motion, myotone strength. I would generally also check DTRs, deep tendon reflex. So to do that, we use a nice reflex hammer. And I'm gonna check your bicep one first. So relax your arm as best as you can. That was a nice little twitch. Beautiful. And then let this arm loose. Good. And then always check each side. Relax your arm. Beautiful. There it goes. Arm straight. Good. So a lot of these are going to be tendon, so deep tendon reflex. So we're knocking on the tendon to get that reflex response. Sometimes it could be what we call hyperreflexia, which it will like really be reflexive, which could mean different things, but generally, right now we're not going to dive into that. Other times it might be less, so it won't be as reflexive as other times. But for Becca, she's really sound and very functional so far. So, upper extremity, done. Lower extremity, if you want to stand up for me. Mm-hmm. And face me. Feet, how they are. Try to touch your toes without bending your knees. Beautiful. Tuck your chin for me. While she's in this position, I want to look and scan her back as well. Look at her SI joints. Visually, it just looks like maybe her left SI is fixated, but I'll reaffirm or confirm with palpation. So come back up for me, please. And then any pain going down or back up. Beautiful. So flexion's good. Just check lateral bending. So bend as far as you can to your left without bending the knees or lifting the heels. Really good. Full range. Go to the opposite side. Just watch out for this wall. Nice. So a little less. You actually are a little bit more mobile on that left side. Mm-hmm. Does that feel the same to you as well?
Yeah.
Any pain with either direction?
Not pain, just that tightness, and I feel it in both sides of my lower back.
Okay. So just some tightness, nothing positive so far. With that movement, we're going to do that extension. So I'm going to have my finger behind your back. Mm-hmm. You're going to bend backwards, keep these legs straight. Rotate your right shoulder. I'm going to push. Any pain?
A little bit on that left side.
Yeah. And then back one more time. More so on that left? Mm-hmm. Okay. So that was just a little Kemp's test. Check out some of the facets might be impinged. And facets are just these little guys here. They're like hinge joints. This is a very ugly model of what a deteriorated spine looks like, and this is not nearly what Becca's is, but just want to show you what the facets are. So when we bend her back, they approximate, and sometimes they just get stuck there and they don't glide like they should. So she is a little bit of a positive on her left side, and flexion, rotation, everything else looks really good range of motion wise. And then let's have you on the table again, checking the DTRs for the lower extremity. So gonna be two major ones, the patella and the Achilles. Nice. Just get that. Same thing. Pretty good. So equal bilateral with the L4 distribution of the patella. Same thing with the Achilles. Good. Nice. So DTR's lower extremity are really sound as well, as expected. And just to go briefly over the sensory part, you're going to close your eyes again. And I'm going to use this tool to do the same thing I did with your arms, but on your legs. So let me know if that's the same as that.
Yep, same.
Beautiful. Is that the same as that?
Mm-hmm.
Good. Is this the same?
That's
Yes.
it. Yep.
Good. Same.
The same.
Same. As expected, everything is sound beautifully. So on your back, please. So just with the upper extremity, I'm also going to check the strength of her lower extremity and make the table a little taller for you. With lower extremity myotomes, I'm going to start with hip flexion. I'm going to push, don't let me. You right dominant or left?
I'm left.
You sure?
Probably right.
That's good. Don't let me push up now. Good. Don't let me push down. Really good. Bend the knee a little bit more. I'm going to press up, don't let me. Strong. Toes to your nose. Hold. You holding?
Fine.
So there's, I would say that's a little weakness. And then gas pedal, toes into my hand. Hold. And that's strong. So a little weakness in her dorsiflexion on her left side. And we're going to test sides. So you said you're left dominant?
Hand, probably not leg.
If that's the case, you're a lot stronger on your right. You might be right. If you were to kick a ball, would you kick with your left?
I was gonna say in soccer I kick with my right foot all the time.
Oh, then you're definitely a righty. Don't let me push. Good. Bend the knee a little bit more. Don't let me pull up. Beautiful. And legs straight. Toes to your nose. Hold. Okay, so a little stronger on this side. And then the gas pedal. Beautiful. So, as expected, myotones strength-wise is pretty good. So she's just dealing with a little probably strain in her muscles in the back as well as that facet in her low back that's causing some of her discomfort. Your upper neck, or upper back and neck I should say, kind of follows the same suit where some of these segments in your neck are a little restricted. So adjustments will definitely help restore better function to the muscles and segments that we're about to adjust. So going forward, for treatment plans, I would recommend a combination of what we call tri-needles, stack it with laser, electric muscle stem, and then eventually active care. So we like to treat patients in different phases of care, so we like to get patients first and foremost out of pain, make them feel better. Once they get out of pain, then we want to get the patient strong in certain areas to reduce future flare-ups. So that's going to entail a lot of exercises, a lot of rehab, and I think you've seen some of our videos out on the floor where we have top-notch world-class facility out there, and you're going to meet Becca there too. So that was the examination, and now I would like to adjust you. Are you okay with that?
I'm alright with it.
Beautiful. So since you're in this position, we're going to start with your neck. first ever adjustment, correct?
Mm-hmm.
The cavitations or cracks that you're gonna feel are not they're not bones cracking. It's gas bubbles being released through the joints, and with your neck might be a little bit louder just because they're so close to your ears. So I want to give you a little heads up with that. We're going to first get your C5, C6. So relax that muscle there. Good. Breathe through that belly. You're going to feel a little pressure. Loose. Let me have it. There you go. How was that?
That was good.
Nice. So this side is going to be a little higher. It's going to be more of a pull. Right there. You're going to drop that left shoulder for me. There you go. How we doing?
Good.
Yeah?
Mm-hmm.
And I know you mentioned these.
Mm-hmm.
Is it like the front or the top?
It's usually like on the side.
Inside.
Yeah, sometimes on this, it kind of goes up at the top.
Okay. So, knee examinations, there's no trauma to the area, so I'm not going to do any like ligamentous tests, but I can see the laxity, if there's any, in that knee from lateral to medial and vice versa. So there's some laxity in that knee when medial to lateral. And that could be from numerous things, some congenital or things when you're born with.
Mm-hmm.
Other things could be acquired. And this is way more lax. Do you feel that?
Yeah, my left knee's always been the worst of the two.
So, with that laxity in the joint, I might not necessarily want to make it more lax by adjusting it repetitively. So, for Becca's case with the knees, it's going to be a lot of strengthening and stability, working on quad, hamstring strength to stabilize that knee a little bit better. So that's going to be part of your treatment plan too.
Mm-hmm.
And dorsiflexion of the ankle. So generally, when we have knee pain too, we always want to look at the joints above and below, especially when we have no trauma to the area. So I know that she's a little weak in the dorsiflexion, and so testing it as well, range of motion wise, she's also a little restricted too in that mortise joint. So you're gonna feel a little tug here.
Mm-hmm.
And that was for the mortise. And same thing there. So certain angles you can cancel out the knees and just focus on the area of the ankle. So now let's get you on your side facing me. This is going to be for that low back. It was positive right facet. So let's start on that side. You're going to feel like you're going to be in a pretzel.
Okay.
And you might feel like you might fall off, but I promise I'm not going to drop you.
Okay.
So you're going to feel a little pressure. Big breath in. Easy exhale. Let this roll. Loose. Oof, good job. And other side, please. How would you describe these adjustments so far?
As soon as I get the adjustment done, everything just feels very relaxed, and if it's like, I want to say a little bit like euphoric a little bit afterwards, like the pain in my neck is not, doesn't even feel like it's there as much as I thought it was, yeah.
That's usually a common answer with getting adjusted for the first time. We're going to re-audit some of the things that we did in the beginning. And same thing, big breath. Let it roll, let it roll. Look past your right shoulder or left shoulder. Yeah, good. So I just felt a little tension build up, so I just wanted to distract her a little bit. And here's going to be the adjustments. So I'm going to bring you up. We're going to reassess some of your audits.
Okay.
And then go from there. So so face me.
Okay.
Let's now all the way up. Oh my gosh, that's way more than before. And then keep that there. And then this was positive before. Is it still kind of catching on that side?
Not as much.
Good. Rotate this way, and your head's about to fall off your neck. So that range of motion, that's beautiful. So, how was that side?
That's good.
Good. And then the last one was the Kemp. So, bend backwards again, rotate your right shoulder, and then how was that side?
It's good.
Good? Okay,
Yeah.
cool. So, we always want to recheck the things that we adjust to see if there's better function, which is the main thing that we are chasing after. We're not really chasing pain, because then we're going to be here forever. So as a chiropractor, physician, I'm always going to tell my patients to focus on those minor ones functionally, even though like pain might still be there. We're never going to downgrade it, always acknowledge it, but really focus on those minor ones that will take you even further in your treatment plan and get you better faster. So that is a short snippet of what a new exam patient experience is like. If you enjoy these type of videos, hit that like button, subscribe, and we will see you next time.